Good morning. My name is Andreas and I'm the Director of Audiology at Hearing Solutions. I'd like to take a little bit of time today to talk to you guys about tinnitus. Question we get very often in the clinic is what is tinnitus? And it's a complicated question and there's a lot going on there. Tinnitus is perception of a sound. It's your brain telling you that it's hearing something, and that's often a ringing or a buzzing. The complicated thing is that something that your brain is telling you you're hearing isn't always in the environment around you, and so others aren't necessarily hearing it along with you, and that can be a frustration. It can be confusing. The other aspect of tinnitus that can cause a lot of debate and confusion is that it's not actually a disease or a disorder itself. It's typically a symptom of something else, and so it's really a frustration for a lot of people, and I think that's important to address. That you're not alone. Many people out there experience tinnitus, and many people are suffering from tinnitus. Actually, a recent Canadian study gave us some really nice insight into how many people experience. And so roughly 37% of the Canadian population, so more than 9 million people experience tinnitus in the last year. And of those individuals, roughly 7%, 1.6 million people found that it was bothersome, meaning that it was affecting their mood, aspects of their life like sleep or concentration, focus, that sort of thing. And so that's a lot of people who have their life impacted by this symptom. Generally speaking, experiencing tinnitus isn't harmful. It's not something that we need to be worried about. And I think that's really important to address, because a lot of people come to our clinic and they're really worried about this symptom that they didn't used to have. So I think it's important for us to recognize that it's not something that we generally need to be fearful of. That being said, it's not something we should totally disregard either. Typically, my advice in the clinic is that if it's not a sudden symptom that showed up really suddenly on one side, and it's not bothering you, maybe you don't need to be worried about it. But we still would recommend investigation. So it's generally a good idea to start this process off with having a hearing assessment. And the process of getting our hearing tested isn't harmful. It doesn't hurt us, and so it's a terrific starting point, because hearing and tinnitus are intimately linked. That is something that has frustrated a lot of people coming into clinics as well, because they'll show up and they'll say, well, my tinnitus is bothering me, it's not my hearing. However, in a large number of patients who have tinnitus, we find underlying hearing loss. In fact, the hearing loss is one of the reasons why a lot of people are experiencing the tinnitus. Changes at the brain level as a result of hearing loss is often why people are experiencing this frustrating symptom. And so starting point is really going out there, getting a hearing assessment. It doesn't just stop with hearing assessment. There's a number of other parts of the assessment that are relevant to people who are experiencing tinnitus. A huge aspect of that is case history and understanding some of the other aspects that might be contributing to those symptoms. And there's also a number of specific tests that we can do in terms of testing the quality and magnitude of those symptoms that can be really, really helpful. Where do we go from there? I mean, one of the biggest frustrations that I have, and something that I brought up during a recent conference, was the sense of hopelessness, and that message of hopelessness that a lot of individuals give people experiencing tinnitus. And they'll often say things like, well, there's nothing you can do about it. And that really hurts me, in that it doesn't really help the individual who's experiencing those symptoms. So I think it's really important that we do away with this idea that there's nothing you can do. That doesn't mean that there's a magical solution. I mean, a lot of people are coming to us looking for a pill that's just going to make it go away. And while I might not be able to offer a simple, easy solution like take this pill and see me in the morning, I do believe that there's lots that we can do about our tinnitus. And so after that first step of having an assessment and having a counseling, we can start talking about what we can do. That first step involves counseling and education, and I believe that's the first part of treatment. for a lot of individuals suffering from these tinnitus symptoms, it has to do with, why am I experiencing this, and what can I do about it? And so understanding what some of the causes behind the tinnitus symptoms might be is an important part of the therapeutic process, an important part of it. And a lot of our patients find that it reduces stress and anxiety, simply understanding what's contributing to their tinnitus, and knowing that they're not alone, and knowing what some of the things contributing to it helps them come to grasp with it. And so a lot of those patients afterwards will come back and tell us and say, you know what, while I still experience my tinnitus, it doesn't bother me as much anymore. I don't notice it as much. And I think that that's really important separation, that even if the tinnitus is going to be there for a long term, our reaction to it, how much it bothers us and how much we notice it, can really change over time. And I think that's an important part of how we can take power over those tinnitus symptoms. The next step of that therapeutic process is, some of the counseling and strategies that we can do. So in addition to that education, there's a lot of techniques that we can use that can help us in terms of distracting us from it. And so those can be simple low-tech solutions, such as, going to bed. A lot of people report that, it's hard for me to go to sleep because I'm hearing these sounds. And the fact that when we're fatigued and we're stressed can even aggravate or make those tinnitus symptoms worse. And so it can be a cycle that fuels itself. And so if we can do things like have a fountain or a fan on at night that distracts our brain from those symptoms that are always there, that can give people restful sleep and disrupt that negative cycle. And so there's a lot of low-tech solutions that can support people in addition to the education and counseling. And for those individuals who that isn't enough, there are the next step that we can talk about, things like masking devices. Hearing aids are a really common solution. I mentioned earlier how a lot of individuals who suffer from tinnitus also happen to have hearing loss. And even though they're maybe not coming to us to address the hearing loss, we're able to address the hearing loss in conjunction with the tinnitus. And by enriching the sound in their environment, we're able to stimulate the brain and disrupt some of the pathways that generate the tinnitus. And in addition to that, just distract the brain and allow the brain to focus on new information that's in their environment, as opposed to these constant distracting sounds that are always there. And so for a lot of those individuals, we have solutions like hearing aids and masking devices. And so there really are a lot of different things that we can do. Some of them are low tech, simply understanding what's going on and having that assessment as a first step is good enough for a lot of individuals. And whether that's not, and we need to take a more active approach in terms of introducing some new strategies or devices to support us, I believe that there's lots that we can do to take power over our tinnitus symptoms. And so start that out by visiting one of our clinics, have an assessment. It doesn't hurt to understand what's going on, and with that information, you're equipped to understand what the next step is. So I hope this has been helpful for you in understanding tinnitus a little bit better and what you can do to take power over it. Thanks.